coming today. This is a training sponsored by CALPACT. CALPACT is the California Pacific Public Health Training Center. We're a grant funded by HRSA out of the Center for Public Health Practice at the School of Public Health. 2010-2011 is our first year of operation. We started September 1st, 2010, and this fiscal year goes through August 31st. So stay tuned for more trainings that we'll be offering. I'd like to introduce our speaker today, which is Dr. Emilia Lombardi. She's
hello.
An assistant.
No, I'm just saying hello.
She's an assistant professor at the University of Pittsburgh School of Public Health. Her research examines the role discrimination and prejudice plays on people's health and access to health care, particularly concerning HIV, prevention, and treatment, and substance use. In addition, she supervises needs assessments and program evaluations that occur within a project studying HIV prevention, knowledge, attitudes, and access to service of people at risk of HIV infection, and of HIV experts throughout the state of Pennsylvania, excluding Philadelphia. The study uses focus groups and interviews and is funded by the CDC and the State Department of Health, and is being used to plan HIV prevention in the state of Pennsylvania. Dr. Lombardi is also a member of the University of Pittsburgh Center for Research on Health and Sexual Orientation. Join me in welcoming Dr. Lombardi.
Thank you. All right. We have one even glitch now. It's not going anywhere. In any case, just a quick background on me. I've been doing transgender, transsexual related research for over 15 years now. I started when I was getting my PhD at the University of Akron, Ohio, and I've just something that is very important for me and that I continued with. One of my earlier studies I worked with what was referred to the gender pack discrimination study back in the mid-90s, which looked at people's experiences with violence and discrimination at that time, and just something that I kept an interest in, and it's really affecting a lot of my work. And what I'm starting to key in on is looking at the relationship between discrimination and health. Looking at it more broadly, and then looking at seeing what can impact that relationship. And an important theory that's been found to really explain the relationship between, say, stress and distress is the stress-distress model. That is, when people respond to stress, they can utilize various coping mechanisms to help reduce the amount of stress, therefore reducing the amount of potential harm that it can cause people's health. Now, the big issue, though, with the kind of stress that trans people experience is to be referred to as minority stress, and this is a term developed by Elon Meyer. Minority stress, according to him, is a socially based stressor. That is, you experience a very specific kind of stress because your identity and your life is very different from the dominant culture that you're living within, and that this is stressful, and then this could cause various health problems. So this is the kind of discrimination I'm looking at, and I'm looking at to see what kind of factors could perhaps minimize the impact the stress could have on discrimination, and at the same time looking at how factors could also affect the relationship. And the big issue that I want to look at is the issue of social support and social networks, and how that could relate to people's experience with discrimination and its impact on health. Okay, and we're back. We're working now. Great. So, yeah. An important aspect that I want to look at, especially in terms of the trans life, is the issue of the idea of transition. That is, how people transition from one gender to another. For the most part, this is seen as being an individual experience. However, I'm looking at more of a social experience, so that the individual, not only does the individual transition from one gender to another, but their relationships also transition for good or bad. And I think this process could impact people's access to social support, and it could also impact their social networks in general. In terms of my study that I'm looking at, is pretty much looking at, does transition affect social support and social relationships? That's pretty much the basic aspect. And then what relationship does discrimination have, and so forth. So what I did was, this is just using a preliminary study. That is, I got a small grant from a university to collect a small sample to really start looking at these questions, which I'm hoping to be able to build into a larger study to look at these issues more further. But these are the preliminary results from this smaller study. Pretty much an internet-based quantitative study. What happened with people who are interested, they contacted me. I gave them a login information. They logged into onto a website, and they entered the information, and they took the survey. The participants were pretty much from the Pittsburgh and Philadelphia regions, with a few people scattered around. And for the most part, convenient sample. There's no real sampling, which is an issue, which we can discuss later if you want. But for the most part, this is what it is. And I'm working with 109 cases. Now, I'm going to go through these slides a little quickly because you should have handouts that explain these in detail, but these are the major measures I'm using, I'll be talking about in my study. This is my primary measure of discrimination. It's around 22 questions that ask about people's experience with discrimination in these avenues. They're being treated unfairly by civic people, their response to transphobia, how do they respond to this discrimination, and also what kind of experiences they had. But for the most part, I'll be looking at it as a global scale. That is, taking these questions and creating an additive scale so that a low number indicates a low level of discrimination. A higher number indicates a higher number of discrimination. Another important is my social support measures. And now, I'll be using a scale that's actually broken down into 4 aspects of social support. Basically, appraisal, tangible, self-esteem, and belonging. Appraisal, again, is how one sees their network viewing themselves. Tangible is pretty much is one of the more common measures of social support. That is, how much aid can you get from your network. Self-esteem, pretty much their ability to get positive comparisons with the other people in their network. And then lastly, their sense of belonging to their group. And then lastly, the social network scale, which asks about their relationships with friends, family, neighbors. Pretty much is just asking about who they talk to and to what extent. Again, small number indicates a smaller network, a larger number indicates a larger network. Now, looking at my data in more detail, in terms of the kind of questions I asked, I pretty much broke it down into gender assignment, gender identity, and gender presentation. Here, I'm pretty much going to be focused more on the combination of gender assignment at birth and gender presentation. So that, looking at my sample, I have a sample of 35 trans men, that is, individuals who are assigned female at birth but have a male, masculine gender presentation. Trans women, there's 53 cases, again, assigned, I said male at birth for trans men, didn't I? In any case, assigned female at birth for trans men, assigned male at birth for trans women, but have a female gender presentation. And then 2 other concepts or areas, those assigned female but have a variable presentation, those assigned male with a variable presentation. So they're much smaller than the rest. And just to do a quick rundown of the differences. And I'm not going to go more here right now. I think there are more important things. Pretty much is looking at the relationship between the measures of support and measures of social networks upon people's transition status. And I think for the first aspect I'm looking at is age of transition. That is, at what age did they pretty much began, where they transitioned from one gender to another, where they began presenting and living full-time as a gender they identify as. And just a quick assignment in terms of the idea of transitioning from one gender to another, I pretty much left that up to the individual in terms of how they defined transitioning from one gender to another. Now, what I want to point out to here is looking at a distinction between those who transition 17 years or younger or 40 years or greater. Those pretty much seem to be, especially those 17 years or less who transition in their teens, reporting much lower levels of social support. This is a very interesting thing here. The measure for 40 years and greater is also interesting because these are people who probably, again, transition in their later years. They're probably more within the first few years of their transition. So I think this is an aspect that needs to be broken down even further. So the issue here being, you have people here who have been living a long time as their gender versus those who perhaps living a short time. And that could perhaps have an impact upon people's social networks, their social relationships. So before I go that, in terms of social networks, I should also mention here too, again, those who transition 17 years or younger, reporting fewer friends and relatives in their social networks versus those others, but more neighbors. So again, the idea that those who transition younger, they seem perhaps have had an experience where their social networks have perhaps had not have developed as readily as others over time. But I need to look further in terms of perhaps looking at how long they've been living as trans as being a crucial aspect. And here, those who are living 18 years or more are showing clearly smaller levels of social support. So it's not just when or what age a person transitioned, but really how long they've been living as trans that perhaps could have an aspect on the levels of support. That is, that you're living longer, you're not having the same opportunities to enhance one's experiences or enhance one's social networks to increase one's social support, perhaps. Again, right now I'm just talking more conjecture than anything else. This is, again, this data is very preliminary. It's still being looked at, and I'm hoping to really expand more upon this in the future. But from here, I'm looking at this, I'm thinking there is something going on in terms of the transition process. Same thing in regards to social networks. Those who report living 18 years or longer, showing much smaller, fewer relatives in their networks, fewer friends in their networks, but generally more neighbors, which is perhaps an interesting aspect there, because it may be that rather than having a much wider source of people that they can interact with, they pretty much focus on their specific geographical area. That is, who are they living close to as being their primary network. Now, some other things we need to look at in terms of this is just looking at age. This is their current age and seeing if there's any relationships there. Because you could think that perhaps someone younger or someone older, that could have an impact upon their social support and social relationships. And for the most part, the older people generally have much smaller network, smaller social support than the younger people. So you could say that this is something that's consistent in some of the literature looking at older people and social support, saying that the older people have much smaller support networks in general. and that looking at network, again, older people, 35 and older, generally having smaller networks. Now, looking at this, I'm starting, again, trying to paint a picture and looking at aspects of transition and age, looking at transition as a developmental process. That is, as someone perhaps lives as a certain gender, they have certain experiences which may be conducive or not conducive towards the formation of support networks, or in basically generating friendship networks in general. And also looking in terms of how people's relationship with their families change over time as well. However, looking further into my data, I found something that was, I think, really crucial and perhaps could explain a lot of the health disparities that a lot of the literature is showing, especially in regards to trans women of color. Looking at social support by race. Now, just FYI, the blue bar, the other, there's only 8 cases there, so I wouldn't put much stock in that. But looking at the comparison between the white cases in my study and the African American cases in my study, the African American cases are showing are really showing a much smaller level of social support compared to the other cases in my data set. And it is pretty clear across the board in terms of different aspects. And if you're looking at networks, friends and relatives, same thing. Much smaller friends network, much smaller relative in their network. But you're seeing generally more neighbors. Again, the issue being that perhaps they're developing their social networks from those closest to them geographically, as opposed to others who they may have a much stronger affiliation with. And this is very crucial because, again, in terms of literature, the health literature, in terms of trans individuals, transgender women of color are showing very high rates of health disparities. In terms of HIV, they're showing extremely high rates of HIV, of very strong mental health issues, and a lot of this has been linked to the issue of discrimination. But going back to what I'm looking at in terms of the factors that could perhaps reduce that relationship in terms of social support or their ability to access resources from the social network. If their levels of social support and their resources from social networks are so limited, their ability to cope with that discrimination is also limited. As a result, their ability to perhaps reduce their level of health disparities is also reduced. Now, in terms of my data, again, we're looking at a small number of cases in my study, 109 cases. I'm not able to really tease out a lot of specifics in it because, again, looking at my data, the African American trans women in my study were already reporting transitioning at younger ages, living a long time as trans and so forth. There's a lot of confounding in terms of what is coming out of this. What is a major factor? Is it transition related or is it perhaps race ethnicity related? But we're looking at, again, a clear pattern in terms of social network disparities that kind of match the health disparities that other studies have found in regards to trans women of color. And then looking at it more closely, this is a linear regression analysis. And if you're looking at basically comparing African American with white and other, for the most part, clearly showing much smaller friends network and much smaller support networks. Even controlling for age, controlling for how long they've been living as trans, controlling for income. So there is clearly an aspect here in terms of the study that the African American sample in my study is showing a much smaller support network and much smaller, for the most part, friends network. And I think this is a very important distinction. Now, looking further in terms of transition-related aspects, the initial thrust of my study, the number of years that they were living as transgender, transsexual, only seem to have been associated with their tangible level of social support and their sense of belonging. That is, the longer a person is living as trans, that is transgender, transsexual, the more likely they report greater levels of tangible support and a greater sense of belonging to their support network. Now this kind of goes into an aspect where as a person ages, or they are able to, again, meet new people, be able to develop new networks, so that as going across the initial transition, they're able to perhaps recover from that initial potential drop in social support networks. But that's hypothetical. Discrimination is also something I want to point out, again, related to only tangible social support and belonging. Issue being here that whether or not those experiences are actually directly related to access to social support, or if it's some other aspect going on here. In any case, this is an aspect that needs further study. From the conclusions, biggest finding so far in my study is the fact that African American cases in my study reporting much lower levels of social support and much smaller friends network than either the white or the other cases in my study. Again, which kind of mimics what's found in the literature regarding trans people of color, specifically trans women of color, in health disparities. And looking at the aspect of transition, looking at how perhaps tangible and the sense of belonging perhaps will increase the longer a person is living as trans. Looking at it as a developmental process, that they perhaps learn more about living as a trans person or living as their identified gender will improve over time. And that discrimination could have reduced their level of, or their access to tangible resources. Now this can go both ways, because when the person experiences stress, such as discrimination, they will utilize their resources to help reduce that stress. So that may be the reason that tangible support is smaller. That is, they needed it, they used it, so now it's reduced. Another way of looking at it is, again, looking at it more structurally. That is, both discrimination and support are both socially based, so that perhaps the same kind of social forces that would increase one's risk of discrimination is also reducing their level of tangible support of their network. So these are the kinds of questions that, in terms of my future research, we'll need to look at. And just quickly, and looking at the relationship between the social support and health outcomes, because I think it's really one of the crucial here in terms of showing how important some of these measures are in terms of health outcomes. In terms of distress, basically looking at measures of depression and looking at alcohol problems. For the most part, all the measures of social support have a clear relationship with distress. That is, the greater level of support they're experiencing, the lower levels of depression they report. And for the most part, you see the same thing with alcohol problems. The more support you have, the smaller levels of alcohol problems. So there is clearly a health benefit with support. But looking at, in terms of social networks, the only aspect that seems to have a relationship is the friends network and alcohol problems. That is, the more friends a person has in their network, the fewer alcohol problems they report. Now, this pretty much brings me to the end in terms of the data, but this is still an aspect that's, again, it's something that I'm still working with, I'm still exploring, and want to explore more with further data. But there is a clear, in the study, the clear issue is that, much like the studies regarding health disparities in trans women of color, my data is also showing a clear disparities in regards to level of social support as well, which I think will impact their level of, their ability to cope with discrimination in their lives. And again, the aspect of transition, thank you. The aspect of transition is also very important in that, again, what happens in the early part of the transition could be very important. And that is something that I couldn't look at in terms of this current study, but something I want to look into is that trying to work with people who are perhaps in the early part of their transition, and then asking them, investigating how their social relationships are changing over time. That is, do their relationship with their friends, their family change over time? Do certain relationships end as a result? Is the decision to end relationships their decision or the other person's decision? I think these are very important questions to look into. Also important is really looking at the kinds of networks that these people are embedded within prior to the transition, because that could be an issue. Because looking at studies that looked at social networks, pretty much looking at income-based networks. That is, low-income networks have been found to be much more limited in terms of the amount of resources available, in terms of the amount of support available, versus higher income networks, which is an issue that goes beyond race as well. That is, even if you look within race, within African American communities, the middle income communities reported higher levels of greater access to resources in their network versus those in the lower income African American communities. So going forward is, again, looking at this idea of transition. It's important to look at, well, where are people starting, and then how does that change over time? I think that's where my research, where I want to bring my research right now, is to investigate that issue. And I think that's it. So I want to open up for questions. Any questions? Here.
Your study,
yeah.
if you continue your study and you want to look at other more data, would you just, what other questions would you explore? Like what other data would you explore specifically?
Okay. The question is, I'm reprinting it for the audio, is for my future study, what other questions I want to use to look at this?
What other kinds of, what more specifically data-wise would you look at?
One aspect is more methods. The goal is to get more people involved, so then I need to expand from just looking at one geographic area and trying to expand it. So looking at multi-sited studies as perhaps the next step, looking at not just, say, in Pittsburgh and Philadelphia, but perhaps Pittsburgh, Philadelphia, Boston, Los Angeles, New York, trying to spread it out. Because they're also looking at how the different regions could also have difference in terms of the kinds of communities that are available as well, which will need to be investigated as well. In terms of other measures, probably want to use more sophisticated social network measures. One type which I'm looking into is basically egocentric generators. That is, looking at with egocentric data. You ask a person about 10 or so, up to 10 or so people that they talk to about important matters, and then you ask about who these people are. You ask about the kinds of relationships they have with them. You ask about how the different people that they reported, if they are related to them as well. So you get a rough idea about the social relationship that they are embedded within. And there's probably a lot others that probably need to be looked at, but I haven't really thought about that just yet. Okay. Right. Oh, all right.
My overall question is, I think you're looking at kind of how social support might potentially mediate the relationship between discrimination and stress.
Yes.
And HIV risk or substance abuse risk. Stuff
Yes.
like that. So I'm really interested that the relationship between discrimination and the different aspects of social support that you looked at seems kind of weak in your sample in the sense that there's only two aspects of social support that are actually statistically significant.
Yeah.
And their magnitudes are really small.
Compared to the other, yes.
Yeah. So how do you interpret that when you take away from that?
Because the sample is also cross-sectional, you're not sure where things are going in that case.
Given all the limitations of the data.
Right. I'm really not sure at this point. I was assuming there would be a bit more consistent relationship because in my earlier study looking at discrimination in health, there was a much clearer relationship between health outcomes and discrimination. I think an aspect that could be related is that there really isn't a relationship between social support or social networks and discrimination. That is, what we're probably seeing there is probably more of a proxy. That is, there are probably more social structural forces that are perhaps influencing both. And I think that's what I'm catching with that relationship. So that's where I'm thinking, looking at the kinds of networks that people are embedded within, like the ego-centered network. Looking at that as perhaps a start, looking to see how that could perhaps impact both support and discrimination. And I think that might key things on, and then the relationship between the discrimination and support may disappear at that point because it's being picked up with these other measures of social structure. Yeah.
I was wondering if you found any distinctions between established networks versus new networks. And so for, say, older people who maybe have smaller support networks, maybe they have stronger networks because they've had time to develop them versus younger people who may have more transient relationships.
Right. Unfortunately, I can't. Oh, I'm sorry. The question was whether or not I saw any difference in terms of. I'm sorry. Can you repeat your question again?
Sure. Is established networks versus new networks.
Okay, looking at established networks versus new networks, and unfortunately, with this data, I can't do that. It's pretty much asking about networks at the point in time of the interview. Now, actually, going back to your question, your initial question from the new methods, would be if I'm doing something more global in terms of a trans study, looking at a wider range of trans people, is to ask them about the kinds of relationships they have at different points in time. And perhaps that might tease out the kind of changes in networks that could occur. But in terms of this data, I can't do that. Yes?
Hi, thank you for the presentation this morning. And the question about geographic location.
Mm-hmm.
It seems to me, at least in my reading of health literature around trans folks, it's mostly urban-based population.
Mm-hmm.
So I wonder if you have any question or any ideas about the relationship between geographic location, urban versus rural, in terms of social support. And if your data is allowing you to sort of begin to make some analysis around that.
Okay. The question involves differences in networks and relationship between urban and rural.
Yeah.
Okay. That's living in Pittsburgh has gotten me to be much more aware of the Appalachian region for the most part, which is pretty much low-income white communities. And comparing to that, say, more urban, and looking at how different things. My thoughts, and again, this is just my thoughts, my conjecture. My thing is that a lot of white trans people, once they know that they're trans and want to do something about it, I think they are more likely to move from rural to urban areas, for the most part. So you probably see, actually they'll probably go for perhaps other people as well. They want to go from an area where there's no resources to an area that there are resources, for the most part, especially if you're younger. Again, conjecture. Those in urban areas, there may be an existing network by which they can attach themselves to. There are studies that looked at how people would join other networks, such as the house ball communities, as an alternative to existing networks, which these kind of communities only exist in certain urban geographic centers. So the issue there with rural is, to what extent, again, are they moving from the rural areas to urban areas? And to the extent, perhaps in their later years, do they move back? That's a good question. Because the same question I think I'm seeing is being talked about in terms of the HIV literature as well. Is what happens when people find out they're HIV? They perhaps go to an area where there are more services, but then do they then go back to the communities? So that, yeah. Any other questions? No? I think that's it then. Thank you.